It's a hard,
Mm.
hard balance. We all want the best for our child, but sometimes the best is not what they can perform for us. And then it will sometimes become a very strong stress to our children just because we want them to talk. Only can use verbal words and cannot use other form. They're very suppressed. So I feel very sad when that happens. And I do hope that they get considered.
This podcast shares personal stories and professional insights, but it's not a substitute for medical advice or therapy. If you're looking for support, do speak to someone qualified and trained in child development or special needs care. You'll find the full disclaimer on the screen and in the show note.
When I first become a father, one day I look forward to a lot. It's when my son can finally call me daddy. However, the wait go on like 1 year. Then I thought it's getting nearer, and then another year. He still has not really started to call me daddy or call his mommy yet. And this is when we first start to realize that, hey, speeches does not come naturally and something might require our attention and we need to get help. And this is the time that we were told by a doctor to go and see a speech therapist and also do some hearing tests. And that was the moment that I realized there's this occupation called a speech therapist. And it's pretty important because it's going to support my son to get the support he needs to allow him to have the skill to start talking and communicating to us what he wants or what not. So today in the 14th episode of Adapting Together, we are honored to have a guest who is a speech therapist to share with us everything we need to know about how a speech therapist can support children who are on the ASD or have speech developmental delay. So this episode will share a lot of insights for parents and listeners so that we have a better understanding on how speeches develop and that it is not something we can just wait for it to happen and take place magically. Of course, I'm not alone. My name is Kevin. I'm the co-host of the episode. And I also have co-hosts like Carmen and Xin Yi together with us. Our guest is Miss Emma Lee. Emma is a speech therapist herself, and she supports children who have speech developmental delay to work on acquiring the skill to have speeches develop. So we will try our best to ask all the questions that we feel it's important to Emma, and Emma will do her best to share with us everything she knows. And hopefully, listeners, you also do your best to share the episode to people to help more people learn about all these things that are very important. So without further ado, let's put our head together to get Emma out. Thank you,
Hello,
Emma, for agreeing to be our
thank you,
guest today.
Kevin.
Hello. Hi, everybody. I'm
Hello.
Emma. Thank you for having me.
It's our honor that you agree to spend time with us as well to talk about this topic. Now, maybe I would like to start a little bit casual note. Could you maybe share with us like what inspired you to become a speech therapist and work with children on the spectrum?
Well, honestly, when I first considered to join this profession, I think after I finished my matriculation and we have to fill in the government system where you apply for the university because I went to a local university. So 10 years ago, nobody know what's a speech therapist. Neither do I. So it's hard to say that I'm inspired to become one at that point. But anyway, I come to discover this profession by checking out those university prospectus, seeing what courses would suit my need. And for me, it was quite basic because I'm a family person, so I'm looking forward to have a future with occupation that doesn't need me to do too much OT, having time with my family, at the same time having things that I like to learn, which is to upskill myself to be a better mother, to spend a very good time with my children, like, raise my kids up. So that's kind of like my model. And then that I think one more thing is I wanted to work as a healthcare profession at the same time. So I can't be a doctor because I know there's a lot of OT and house management to do. So that guides me narrow it down to either a dentist or audiologist or a speech therapist. So then I applied. I didn't get it actually at the first chance, then I actually transferred into the course. So it's quite a long journey to get there lah. But anyway, so once I got in, I liked it very much, and I think it's really something that suits my personality, and also the job itself is very noble and I think very rewarding in nature, where I get to actually nourish a child's language development, which actually is a very important skill set to have for their future learning and also for their living skills in general. So I would say that I didn't regret that change in my uni choices, but yeah, it that's how I get to become one. Yeah.
Looking backward, it was also good that you made this choice, and therefore now a lot of children have benefited. And
Well.
for at the same time, maybe for listeners who was like me before a few years ago,
Mm,
who may not totally be not familiar with how what does a speech therapist, or the actual name is quite lengthy one, right? Speech and language pathologist. But would you be able to help us understand a bit what do you do to help children or support the children?
yeah. So perhaps I will just explain a little bit why they have to be so lengthy, speech and language therapists, and it's actually the same as speech and language pathologist. It's just the terminology difference comes from different country of practice. So US we call it SLP, whereas the UK will call it SALT, speech and language therapist, and maybe Australia, New Zealand they call it speech and language therapist. So what we do, as the name suggests, we help children with not just children but any individual um, with their need to two things actually to eat and to
Mm,
talk. So in general, that is the most basic function of our mouth and our vocal cord, this whole area. So that's what a speech and language pathologist is supposed to do. So we diagnose, we provide treatment and assessment and therapy treatment, sorry, in the area of speech difficulties, language and communication delays and disorders. That just means some children will have difficulty in developing language by themselves, so then we come in place. Or even an adult who has, let's say, had survived a stroke or an accident or cancer or anything that causes the inability to communicate again, be it the loss of voice or the loss of the ability to find their words. So that's where speech therapies come in place. Some speech therapies also provide a lot of support to individual who needs help with swallowing and feeding. So it's quite a wide scope of practice, I would say.
So you mentioned a few area or roles that a speech therapist can support a person or the
Mm.
patient, which to me is also new, that I realized that, oh, eating and swallowing also is part of the thing that we need to look for someone like you. So does it mean that there is any area that a speech therapist will have to like specialize in or focus into?
Well, in countries that this profession is a bit more established, let's say the US, the UK, a lot of them are very specialized in their area. So you will find speech and language therapists who solely deal with cleft lip and palate uh, rehabilitation, let's say. There are some that just work very specifically with voice disorder, let's say someone having difficulty with voicing, and some just work very closely with children that is deaf and hard of hearing. So, but in Malaysia, I think because there's not many of us, so we are forced to be a bit of a generalist. So most of us will separate ourselves to, are you a adult speech and language therapist or are you a pediatric therapist? So
mm,
in that way, I'm a pediatric speech and language therapist, which means I work mainly with the children and teenagers population. So that's my specialty, if you want to put it.
mm,
But I do have areas of scope of interest that I personally find myself very more confident in, if let's put it that way.
mm,
Yeah, so I guess most therapists in Malaysia, it's a bit like this situation now. Yeah.
Based on my experience, especially I remember the first time I see a speech
Mm.
therapist with my son. She asks us a lot of questions, like interviewing the parents, And then she also, of course, definitely pay attention and observe how my son interact with her and play. Um, so at the end of the session, she told us something that is still struck me even until today, is that she said, based on her observation and everything she gathered, she said, your son is likely like around his developmental age is like around 9 months old. And
Mm.
actually, at that point of time, my son is about 2 weeks removed from celebrating his 2 years birthday. So that was the
Oh.
time that in that room, it was like my world is like, what happened? It's like a lightning just strike. How can a 24 months old boy, and you are telling me that he is about 9 months old only? So
Mm.
that was also the time that I realized, how do you check all these things? So it's like, is there a milestone that uh, we have to observe like a child to understand whether this child is developing according or normally? So
Mm.
maybe if there's anything like that, can you help us to understand if there's any milestone that a child will supposed to develop in certain area or certain skill
Mhm.
before speeches form?
Yeah, so I think it's understandable why a lot of us are waiting for the first word, or unless a child talk, there's nothing much we can do, you know. A lot of time those background undergoing work in our brain, we don't know, we can't see. The only thing we can tell is, oh, my child is talking. So
Mm.
before my child talk, I don't know what's going on, but how come you suddenly say my child only 9 months old? You know, what are you looking out for? I think that's a very fair question. So I think one thing we need to realize is that why does a child only get their first word in first year? Usually, I mean that's like a milestone, right? It's because it takes that whole year. All our children are very busy learning all the essential skills that leads to talking. Um, then I think that is what Kevin was saying as milestones. What are we looking out for at what age? That tells us where the child is. Lah. So to put it simply, we keep an eye on the earlier milestone and then we want to encourage that to happen. Then as a speech therapist, we look out for some of these. So I can list that out for you if that would be helpful for the parents to just have a quick check.
Mm-hmm.
Yeah. So yeah, as a parent myself, I also am very into all these milestones, sometimes a little bit too much. So I have to control my occupational hazard lah. Yeah, because we all are waiting for the first words to come out, right? It better be mama, right?
Yeah.
Yeah. So actually, honestly, before that, I'm as a speech therapist before being a mom, I look at all the milestones. It's almost like a checklist. So I will see like, oh, let's say if I see your son Kevin, I'll say, okay, have you? Let's say if he's 2 years old, then I'll look from 2 years old backward to see, okay, can you speak two words in a sentence? Cannot. Okay, let's go backward. Do you have your first word yet? Don't have. That will be like 12 months old usually. Then we go backward. Okay, what about 9 months old stuff? So we go like that to check around where age equivalent would be your child be. So that's how some of us use milestones for professionally. But I think for a parent, it'll be helpful to know 0 to 1 year old, those very foundational years, because I think it gives us a bit of assurance to know where our children are if they are on track to get their first word soon. Yeah, so I have a few that I list down based on the ASHA website. So ASHA is the American Hearing and Speech Association. So it's basically the professional body that governs speech therapists in America, but they have very resourceful websites. So I would really recommend parents to have a check. And I'm just gonna maybe highlight a few that is important. So the most happy one, I mean, after being a mom, right? The happiest moment is 2 months old when my baby starts to smile back to me. A social smile, we call
Oh,
it. Yeah, when they'll
so
look into your
nice.
eyes and smile at you meaningfully. Because smile can be a reflex, you see. So when a few weeks
Mm.
old, the child can smile, but it doesn't mean anything. But 2 months, around 2, 3 months old is when they really smile for a reason, like because you're there, you're carrying it and he's happy or he or she's happy, then she'll smile. Or you do a peekaboo and she likes it, she'll giggle. So that's two
Yeah.
months old. Yeah. So I think mom can resonate. It's
Yeah.
like, yay, finally my baby got respond, you know? Yeah. And then 4 to 6 months old, let's do 2 months later. So 4 to 6 months old, you can realize that a lot of milestones have this little window. So don't be too happy if they get it by 4 months or these two, it's not very indicative of how smart your kid is. It's just that every child develop in a different pace. Some of them slightly earlier, some of them slightly later. It's all right as long as it's not too deviate too much from, let's say, 4 months or half a year old baby still doesn't do social smile. Then it's a red flag. Ding ding ding. Then we need to actually by then you should get it checked already. But a lot of time this thing doesn't come in mind because it's not talking, right? Yeah. So anyway, so 4 to 6 months, what they do is you see that baby reacts to voice and sound. So let's say mommy from another room, you see your baby, you know,
Mm.
looking to that direction and say, hey, I need that person. Where is he? Where is she? So then the baby will react towards that direction and they can follow object with their eyes, which is really nice. Let's say you show him, oh, changing diaper. You can see the eyes looking at the diaper because you're showing something. So this is when their little mind is already starting to hear familiar sounds to relate to those items, you see. So these are those background work lah, before we actually see result, which is talking when they turn one.
Means
And then
even
seven,
tracking,
sorry, eh?
even be able to track our finger or movement is one indicator as well.
Yeah, it is because it shows that the child is actually able to focus and zoom out other things that's not very important at that point based on that context. Like, oh, my mom wants to show me something. I will zoom into that. It's a very interesting cognitive ability that usually grow around that age.
Mm.
So you see, all these are very indicative of in the future. Can you zoom into the thing that my parent want to show me and tell me about, and then I can learn it. But if I don't have that ability, then it's very hard to learn language. Let's put it that way. Yeah.
Yeah. So sorry I
So,
interrupted you
mm,
just now. Please
yeah,
go.
that's okay. Yeah, so I'll go to 7 to 9 months. 7 to 9 months is quite interesting. Is when you see they're a bit more active physically to communicate. They raise their hands out to be carried, and then you say "mama," then they'll turn to look at the mom. So you can see the understanding side start to form clearly already. And then you can see that they have very clear preference. I don't want you to carry me. I'm going to push you away until I get the right person to carry me. And then if you
Uh-huh.
say no, their face will be like, they'll pause for a
Nothing.
while and say,
Yeah.
yeah, what's wrong? You see? So this understanding actually comes quite early. And when I have a child, I'm like, oh yeah, it's amazing how they understand something almost 3 to 4 months before they actually start saying them, which is really cool. And then 10 to 12 is the most exciting time lah when we see that our baby starts pointing, waving, showing, give mommy the bottle. If she's holding it, she understands the word give. Then they give. So like all this is talking with their hands almost. And then you will see around 12 months, that's when first word comes. Yeah, so that's the little baby steps to get to talking.
These are really very series of baby steps indeed.
Yeah, it is. Pun intended.
I
Yeah.
mean, the thing
I
is, hearing all these and looking back, these are things that I didn't know I should be sensitive towards or very observant about. And
mm, mm,
now I'm thinking if I only know all these things, if I knew Emma 4 years, 5 years early, maybe I'll be looking at different things. And like you say, ask him to give something or take away something. Then if he doesn't say no or have frowning reaction, then I will know that okay, this is some red flag or earlier lah. At least
Hmm.
12 months to tell me the level is 9 months is 3 months gap. It feels a lot
Yeah,
easy compared to 24 months and they tell me still
mm,
single digit or 9 months. That feeling and
understand.
mm,
I cannot forget it.
Yeah, I
mm,
think I think sometimes we can't really it's nothing for us to really regret about. We just have to look forward and hopefully that more parents would come to have this awareness of like almost like self-checking, and then we can get things done earlier. I think this
mm,
is the current. I'm quite encouraged to see that actually more and more younger parents having all the information by hand. They are a bit more aware now. So we actually do get earlier referrals nowadays compared to when I first started in the profession. So we will see some children will come maybe like 4 and 5 years old because the grandpa or grandma will say, oh, wait, lah, wait.
Mm,
You
mm,
also speak at 3 year old what? You also late what? So you maybe confirm late. Ayo, no lah. So if we could have helped early, actually a lot of things could have been done lah.
yeah,
Yeah.
yeah, yeah,
Emma, I'm just curious, right? Let's say,
Uh,
it's quite common for older people to say, who also talk 5 years old. And maybe it's not rare that our own family really have some of the children, they really were late talker.
true.
But
Yeah.
if if the other milestones they match, but just the language of speech not yet formed, is a less
Mm,
of a concern compared to if the rest of the thing really cannot see also, then
mm,
I think it makes it a lot more justifiable to have the concern or to tell those
that's right.
people, don't talk to me about who were late talker, but all these things are mixed out already. So I really have a strong reason to be worried.
Yeah, so I think that is the difference. I think a lot of people will be confused, like maybe let talker leh, maybe not speech language
yeah.
delay leh. So
Mhm.
I think that's a very natural response, and we understand because we don't want to unnecessarily, create stress to the family. Oh no, now you need to go and see speech therapist because your child is not talking at like 13 months old. You see, then I guess what Kevin said is really helpful, which is sometimes not about just the age, but it's about at that age does the person already have the prerequisite abilities and skills that they have to hit at those months? Let's say those are in place, but it's just not having first word yet at 1 or 1.5. We are not as worried. And sometimes speech therapists will even tell you, I think you just have to continue to stimulate language, spend more time engaging the child in book reading and something that they like, play more, interact more. The word will come. Sometimes speech therapists will tell you wait and see because you're like, your baby has a bit more room and time to grow into it. So let's relax. But sometimes we are happy to have those parents because we're happy to at least help them to assess and see whether is it something that needs to be intervened or something that we can naturally wait it out. So I think um the difference is that that is a late talker. If you have all the prerequisite skill, but you just don't speak your first word verbally yet, that one we usually call it late talker. Some children would take like the whole year just to listen, especially bilingual or multilingual families. The brain is a bit busier, to listen out the different patterns. So sometimes they will be having a slightly late start, but that's okay. It will come. But what happened is when there's a lot of gaps, we
Mm,
don't just call it a late talker anymore. That is something that is worth attention. Yeah.
mm, mm.
I'm
Mm.
sorry to
Mm.
co-host also. I have something to jump the queue that is related to what we are talking here, Because let's say like 12 months, 13 months already, right? If like,
Uh,
yeah, I see, you're not talking, oh. So,
Mm,
you know what I thought was logical and reasonable to do is let's give him some references on what to say. So maybe this was time that parents were at risk to on YouTube, on cartoon, and
oh.
teach the child. And now looking back, I already learned that this is not good for the child.
Yeah, it is understandable, especially some parents they say, I want my child to learn English. My English no good. So I on YouTube to teach English, you know what I mean? But they will learn. They will learn things that you can learn very concretely, like alphabet, numbers, colors,
mm,
concepts. These are easy to learn with screen. But the problem comes when it comes to actually functional communication because we talk two ways, right, Kevin? You talk to me, I talk to you. So, so, but YouTube doesn't, I talk to you, you talk to me. That natural interaction is missing. So, so it's actually not helpful when it comes to that lah. So, nothing beats a good adult and child interaction because we naturally provide the how language works as a model to our children when we interact. Even if you talk with your wife or your family member in front of the child, it's better than YouTube. You know, like you're just talking to them, hey, what are we eating today? And then someone will answer, we're eating apple with orange for dessert later. See, there's a to and fro. Then they see, this is how communication is happening, and then there's context to support. I mean, you ask me professionally, that's how I explain to parents usually. So we would rather have that. Yeah. It's amazing. And then, I mean, if you talk about screen, I can talk nonstop because really now there's a lot of referrals that come in because of that. So I maybe have to talk about it another time. But I guess just one cautionary word is that if you want your child to talk more, you gotta talk more to them. Screen cannot replace you. You are the best. That's all I can say for now. Yeah, I guess in short, that's how I'll put it. Yeah.
About sorry, I also cut you. How about
No worries.
how about some parents say it's really true, their English is not good. So, but then they really want the kids to learn English, So what will your advice for the parents,
Yeah, I think, you know what? Actually, there's two ways to think about it. Number one is we always try to acquire, as a Malaysian, right? We need at least three languages, right? At least. So we are
At least.
naturally a multilingual community. So we need to learn a lot of languages. And then sometimes, we are afraid our children will be losing, at the starting line because we don't have all three one shot. But it's okay. I would say that at least you have one strong language. Actually, it's much easier to learn the second language. So let's say if you are very fluent in Mandarin or Cantonese even, and you give very good language models for the very strong language, it actually grow the language brain of the child. And then
Very.
when you teach English, it's very fast, it gets in there. But it's, of course, if your situation allows, it's best to have the main language that you wanted to teach to have equal input, equal quality input. That means maybe the mom will speak a language, papa speak a language, and then your house helper or your spouse speak another language, and then they all have their chance to talk to the person in full and nice sentences. That is actually helpful. So let's say if the mom alone can speak Mandarin and the whole household speaks Mandarin, and then you want a child to learn English, I would suggest maybe you can go to a play group or a natural situation where English is the main language. So then naturally the child will then hear in a complete context and it will be really helpful. So that is another way you can do it. But just don't be worried if you just can't give that language at the start because other things can come in. You can use picture book, you can use audiobooks, you can use, I mean, there are some good low stimulation show online that you can show. It's just not those short YouTube snippets of colors or baby sharks about colors. And those are very addictive and you just get stuck at colors and then you don't hear enough of full English sentences to learn English anyway. So I rather you watch, if you really want to watch something, watch stories. Complete slow paced stories. It really helps. Yeah.
Okay. Your turn now.
Yeah. To have it balanced, right?
It's
Later,
okay.
Kevin will cut.
Well, because I was looking at some of the questions has already been addressed, so I will just go right in. Correct. Okay, so Emma, thanks for just now. It was very reassuring and also detailed in sharing about the milestones, and then we talk about the multi-language in a family. Moving forward, we have a question regarding children who are in the spectrum, like in autism spectrum, and also a kid who just have a speech delay. So can you help us and our audience to understand how can parents recognize that they are different, and also how can we recognize the differences between these two?
Right. I think this comes across because a lot of parents only realize or do an assessment on autism because the child is not talking. Usually that is one of the first sign that they get intervention. And a lot of time it leads to a diagnosis of autism spectrum disorder. So I think that's why a lot of time people are very confused by these two. Does it mean that if my child has speech delay equals he or she is on the spectrum? So that's a very good question. So it put it very, very succinctly. Child can have speech language due to many, many reasons. It's almost like one of the characteristic of children on the spectrum, individual on the spectrum. But if you have autism, a lot of time you will have difficulty in communication. You may have a lot of words, but you will definitely struggle with social interaction and use of language in the social context. But if you have speech and language delay in any other form, it may not necessarily mean that you have autism. So I guess it overlaps, but it's not equivalent. I hope that explains. Yeah. So I think what would also help is looking at the definition of what autism is. So autism spectrum disorder, it's we call it a neurodiversity, which means the brain is, imagine you are having a CPU, is wired differently inside. The wires work differently. So as a result of that, usually you will see that individual will have three main things that we're looking out for. We're looking out for is someone having a difficulty in social communication, restrictive and repetitive behaviors. So some of the child have very specific dislikes of like certain material of shirt, like really specific about it, or super focused on obsession of like, let's say, dinosaurs, like, he knows very much about dinosaurs and
So much
dinosaurs.
detail. Yeah, just dinosaurs.
Yeah, it's
I work
amazing
for-
actually. It's a
Yeah.
superpower.
Yeah, I'm surprised. Like he knows all the species about that because he just spent a lot of time looking into that thing that he's very interested in.
Yeah, and also other than that 2 points, one more is a lot of them have sensory processing differences. So I think this field is what qualifies someone to be under the spectrum. So that is autism, and not all children with speech and language delay have those.
Yeah.
So if that makes sense, so some of them just really have difficulty processing language. And as a result of that, causing some social difficulty, which is like, when you have no speech to communicate, you get a lot of frustration, and then you see this child melt down a lot. Or this child doesn't have friends in school because his language is not the same as the peers' language, and it's hard to make friends. As a result of that, having the social difficulty. Otherwise, he can play with younger children. Then we know. So I guess this child is just a language delay child instead of a child on the spectrum.
Yes.
Yeah.
Understand.
So I hope that clarifies.
Yeah, thank you for breaking that down also. So we know that children with autism, there's because of that the diagnosis, they could have development speech delay, but
Mm-hmm.
kids with speech delay, they don't necessarily is in the spectrum. That's what Emma
Yeah.
is explaining.
Yeah.
Okay, I think that really clears up a lot of confusion. So now let's say like a parent brings their child in for the first time for speech therapy. What would actually happen during the first meeting with a speech therapy, or like how does a session normally look like?
Right. I guess different therapists might have different preferences, but for me, the first session is almost like a consultation assessment session. Sometimes depends on the situation and also the age of the child and the client. Let's say it's a very, very young child and who is a bit nervous, then maybe I'll first do an interview with the parent to understand the child a bit better. And then after that, I just like how Kevin described from the start, where he had an experience of the therapist will look at how they interact. That's particularly because as a therapist, I'm totally new to the child, right? It's unfair to say that, oh, he doesn't talk to me, I cannot talk, cannot. So we usually try to make it as natural as we can, which is with the parents, out in the whole room, the child and the parent know each other the most. So let's watch them. So sometimes even in a new environment, that doesn't happen very well because, that's not my toy. I don't know what to do with this toy. It's not my toy. So we even sometimes will ask parents, oh, you go and record something at home, what you do with your child, and then send it back to me. So in that way, usually that's what we do just to gauge where the child is. And it depends on the age and the purpose, right? So let's say we are talking about children on the spectrum at the diagnosis stage, which is maybe to preschool age, I would presume. Then usually we would have some assessment done, which is some of them are quite standardized. For example, if you are a child that will need a full assessment to understand where the child is, usually we will do some assessment on a few areas. We'll do to understand if the child has difficulty in understanding language, or is it difficulty in organizing sentences, or is it does the child has any structural difficulties. So we usually look at a few areas like that, and then we can from there probe where could be the possible missing gaps that is causing the speech and language delay. That's one thing, we're trying to find a cause. Second thing that we're trying to find is where is that child at the moment. It's just like how Kevin get told, 9 months. Oh no, the judgment is 9 months. So
But I did not
that is,
expect
I know, but that's an important step to know that where is our next step, you see. It's unfair for the child that, just because it's 24 months, you gotta do 24 month stuff from now on. But there's like huge missing gap in between. So we try to identify where is the current abilities, the current level of use of language and understanding, and then from there we start to build it up, and hopefully that will help the child to grasp more language and then actually function better as a child in a school or home setting lah. Yeah, so and usually for my practice, because I'm very pro family involvement in my session, so we actually discuss with the parents on what actually is their main goal. Because for some parents, for us, we really want the child to ask for things, but the parent just wants the child to say no when you don't want instead of a meltdown. You see, so different families have different, actually very specific hope for the child. So we try to guide parents to set a goal that is actually relevant for the family, and then we work from there, and hopefully that slowly closes a gap for the child. So that's how it starts. And then usually after the first, after we find out what's our goal, what's the issue, where are you right now, then we start with therapy sessions. Yeah. Yeah. The reason why we need therapy instead of prescribing something for you is because there's just no magic pill for you to eat and you can talk. Like that, I also don't our job, right? But it is the wonderful nature of brain actually, because talking is such many cognitive function comes together. So to learn to talk and to learn to communicate will require a lot of practices, meaningful practices that gives good positive experiences to the child, and then that shapes that area of the brain to learn how to do it. And then the child will be able to diversify and use that particular skill in a wider context. So that's what therapy is supposed to do for the child. And when do we stop? A lot of parents will ask, like that, like that. There's no particular 10 set of things that we do, then finish. Cannot. Then we usually have to explain to the parent is that, the end is where you define your actually almost the family defines where it ends. Let's say if the child has acquired what you think he needs, and medically speaking is if fulfilling the child's function in school and family, we can stop it there and see where the child is heading to, and then if there's any needs again, then they can always come back. But the stop is when the child's need is fully met. That's where we put a full stop or a comma for the journey.
So you're saying the parents' involvement also in determining that expectation and also along the journey.
Yeah. Especially, I think this is particularly true for children on the spectrum, because we see that the spectrum is not something that will disappear, but it is a neurodiversity that is with the person for lifelong, you see. So I would put it away that a lot of my children on the spectrum is my long-term client, because as the age evolve, their needs evolves, and then they will continue to have me as part of their team to support their growth and need. Sometimes even 20 plus years old, I have clients that is still with me because they are now working on language they need in their vocational needs. You see? So then it changes. So yeah, so I would say because of that, children on the spectrum, it really depends on what is the need for the family. If the family finds that, at this point we have enough language to learn, we're happy with that, they are happy to explore other things like, go and learn a sport or something, I'm very supportive of that. Yeah.
So Emma is saying, I know from all that very detailed explanation, we learned that no speech therapist is really not helping somebody to talk only, but talking
Yeah.
so much more about communication. And even right now, we're gonna talk about the social communication, which is also a very important aspect. So we would like to ask, like, how can you explain how social communication or interaction skills are built in a speech therapy session?
Yeah, I would say that is actually one of the very core area that we work on, because the purpose of us talking is to have that communication happen.
Yes.
So it's the context of talking or
Yes.
understanding. So in a way, it's usually we will really start with interaction first, because that's how human beings come to learn to talk. So so you can see the skills that they are learning pre 1 year old. A lot of time it is break down into smaller pieces to teach it to the children, especially those with delays. That means they must have some difficulty in filling out these gaps by themselves. So what we do is we actually do it in a multiple way. One, of course, family is the main context that they're talking with, interacting with. So we pull the family in. Sometimes we pull the teachers in, or sometimes we work with different professionals like Carmen and Xin Yi, their early intervention center.
Correct.
Yeah,
The
so everybody comes
the session,
together.
right, comes together and see how you do the session.
Yeah, so that's really helpful, because then you can see, oh, I come in I guess in a coaching position where this is how you create opportunities for communication and interaction to happen. That leads to learning of language. So I would say it's a very strong emphasis in speech therapists. It's first, we gotta teach the child that interaction and communication is useful, meaningful, and fun. Because a lot of child, once they learn to request, they will never stop. They will go, oh, that's
I
the way to
want,
get things
I
done.
want, I want,
Yeah, I want that. I want that. I want
I
that.
want,
I
I
want
want this.
that. Yeah. So you see, so if there's a reason to communicate, then there's desire to learn how to communicate. So we usually have to kind of tease the child into that reason to communicate and give a way to it, especially if something that they really desire to do. That's when actually language comes into a useful tool that they wish to pick up. Before that, they just feel like, I don't need to talk. My parents understand me anyway. They can guess
Yeah.
what does my cry means. It's okay, no need to talk. But sometimes,
That's what we
well,
did.
we are good parents, we fulfill our kids' needs. So sometimes a little bit too much. Yeah, as a speech therapist, sometimes that's my role to teach parents to how to back off a little bit and actually just give room and space for the child to realize, if you don't communicate, people other than my parents may not understand what's going on
Yeah.
with me, and they don't understand that I don't like it, and then they'll keep doing it. I will be upset, and then they'll be frustrated that I'm upset, and then the cycle goes on. So it's helpful that they acquire things like, oh, I know how to request, I know how to say no. These two skills is usually the first interaction and communication skill that I would love to teach, instead of hi and bye, because it really changes the child's life, knowing how to say no and tell what he wants. I guess that's the essence of talking at the very beginning, right?
I
Yeah.
Thanks, Emma, for sharing that. I think that two are always a good start, good goal to set for our kids. Yeah. And now the following question would like to check with you is a bit about the term that that parents
Mm.
or professionally always use, like non-verbal, or the term that minimally verbal. Yeah.
Mm.
So can you explain what those terms really mean and what they look like in everyday's life? Yeah.
Yeah. In short, actually, non-verbal or minimally verbal, as it's as the word suggests, is that a person is unable to acquire or use spoken language to communicate due to whatever reason. So this doesn't mean that the person cannot say anything or cannot have a sound, but it's just that the sound doesn't or rarely sounds like words. So for situation like this, it actually would mean that the person must have a lot of difficulty just to organize those words and sounds. Let's put it even shorter, to organize those sounds in their head to form words, or even just to relate all these sounds to a particular meaning. And that's why the acquisition of a verbal language is tricky for the person.
Mm.
So
Do you
that's why you will
you
see some adults who are, or maybe teenagers, 12, 13 years old, who barely has any verbal communication. Usually those are what the professional doctors or therapists would label as non-verbal or minimally verbal.
Yeah, so actually, because I also have a lot of clients when the kids
Mm.
can actually say, I want banana, no, this. But some parents also kind of label their kids as like, oh, my child still non-verbal. Maybe for them it's like, they're not communicating, right?
Yeah,
So
that's
actually, if they
different.
have
Yeah.
sentences, even one word, two words, or many are just nouns, or verbs, these are still considered verbal child. Am I right?
Yeah, I guess
Mm.
it depends on what the parent means when they say that. What's
Mm.
helpful is if the child can actually pronounce words and sentences, but it's very limited set of them. I guess what the parent means is that the child doesn't use verbal communication as the main mode of communication. So despite having particular nouns, let's say the child likes Dora the Explorer, so he or she can say everything about Dora the Explorer.
The
That's it.
rest
Yeah, and use that to talk. Like, if he wants water, suddenly you talk about a sentence in the episode, that means I want water. Or another
Yeah.
sentence about backpack means I want to go out. So
Yeah.
then it actually, I would say that it's maybe what the parent means is talking, the way she talks is not fulfilling the needs of communication. So perhaps that's what the parent means. Yeah. It's
Yeah.
different.
Okay. So let's come back to for children who are non-verbal, okay, maybe, or minimally verbal, how can the parents can help them to start communicating?
Right. So again, for me, it depends how old you are. So if you're 2 years old, you're not using words, I would say I'm quite hopeful to still continue to develop that speech to come about. But let's say if the person is a teenager, 13, 14, their needs are so high, there are multiple various things that they want to say, but the word is too far away. Usually what we do is we try to encourage the person or the family to embrace other mode of communication. So you might have heard of words like AAC. A lot of people are saying AAC. That just means alternative and augmentative communication. That means alternate ways or assisted way to communicate. So some famous people who are at a certain stage of life that's non-verbal, like Stephen Hawking, that he uses a device. Yeah, so even Stephen Hawking has a device and he talks, but not with the mouth. So that's
Yeah.
aspiring, I think, to a lot of us that, even though the person may not have a voice of his own from his vocal cord, but there's still many ways to teach a person to communicate.
Yeah. And in terms of when we talk about AAC, I think many parents will first think is saying no, because when you use AAC, there's their belief is like when they talk using the device, they won't talk, they won't put initiative to talk anymore. But I believe you came across this question multiple times. Maybe you can give an advice, to the parents who listening now. Yeah.
So I think that worry is logical, let me put it that way, because the device is talking for him. Then what does he have to do, right? That's a natural reaction. I can understand, But then also, I think the second layer is that hope for a child. I want my child to get speech to be like other children. So I think it's also that is finding it very hard to accept that my child would have to use another mode to talk. Is my child less able? I don't think that is something that we are trying to suggest. We are suggesting AAC to the parents to have another mode for the child to communicate, another mode for the child to continue to learn. So it's almost like using WhatsApp. If you want to talk to a person, but now I cannot talk in meeting, right? Then you start typing.
Message. Yeah.
Messaging. Yeah, that's AAC, right? So we
Yeah.
all use AAC. It's not really trying to label your child would never talk. But in fact, it is a way to allow our children to keep talking. In fact, keep communicating, even though the verbal words has yet to make sense in the head. And you'll be surprised because sometimes when we use a different pathway, you engage different part of the brain, let's say the more visual part of the brain, and then visuals make sense to that child. And to just straight away poke at the device, let's say some of them they use an iPad with a communication app in it, they can just straight away type out a sentence even though they have 0 words coming out from their mouth. It's amazing. Then that's when a lot of us realize the child has thoughts but cannot say. Then would you rather your child learn to only say them when the ability to form spoken verb come about, or we want them to express now? So I think all parents would choose the later because we do want to hear what they're thinking. So
All right.
I hope that encourages you to not shy away from AAC. But in fact, use it as a tool, right? It's augmenting, right? So it just assists the child to get to talk. And once the skill of communication gets built up, some of our children actually get a lot of motivation to talk verbally because they
Yeah.
find pressing too 麻烦, and then they start to,
Yeah.
I'll just say it lah. Sometimes
Yeah.
kids will do what's
Correct.
the easiest for them, really. So
Yeah.
I think that's the assurance I try to give lah. Yeah.
Yeah. I
Then
totally
you
agree.
teach us too. Yeah. Okay. Yeah, go
Yeah, I
ahead.
totally agree. It's like if given a voice, right, it's faster than you go and type. Yeah. So if they can, they already use their voice. It's just because they
Correct.
can't, they will have to, have another alternative. Yeah.
I
I think
think
this is a
very
bit sensitive to say, but I still want to say it, is that sometimes we think about it, is it what you want or is it what your child wants? You see? It's a hard balance. We all want the best for our child, but sometimes the best is not what they can perform for us. And then it will sometimes become a very strong stress to our children just because we want them to talk. Only can use verbal words and cannot use other form. They're very suppressed. So I feel very sad when that happens, and I do hope that they get considered to actually have a way to talk. Yeah.
So what advice would you give to parents who feel worried because their child isn't talking yet? Yeah. What would be the advice that you give?
I would say first thing, you're a good parent because you worry. You know what you want for your child and you know what your child should be doing now. And so it's right to be worried. So that's a good first step. But the second step, other than worrying, is actually come to find help lah. I guess if you are feeling a bit helpless, don't know what to do, what went wrong, it's always helpful to speak to a professional and speak to one of us as a speech therapist. We are very, very honored and happy to just journey along to find out what's going on. And sometimes even just a consultation helps. At least you know what to do next. But another thing I would suggest is actually you can read out on a lot of articles online. I think a lot of parents nowadays are very savvy and they know what to do to dig for things when things happen. Everyone just type Google, my child's not talking, what to do. So I guess there's a lot of information for you. But to make it fast for you to just pick up and do right now, I would say is just find something that your child really like to do and do it with the child. Some child might like baking. You don't like baking, sorry, but your child likes baking, go and bake. Or if your child likes a particular game, play with them. And when you play, talk to them about it. If your child likes to just blow bubbles, that is a good thing to do. But the most important thing is just that having a model for a child to interact with and learn, a person, just having a person with the child and talk to the child. I think that really helps a lot. And that is what all parents do at the start anyway. When we hold a non-talking baby, what do? Just talk, right? You just say,
Yeah.
oh, mama is changing your diaper right now. You never stop talking. So just keep doing that. You just, oh, I'm filling out your bottle. Oh, you look very thirsty. Let me give you some water. You just gap, like a radio at the side. Or
Yeah.
there's one thing you can do. We call it parallel talk. Basically, you talk about what's going on in the situation. That's one thing you can do because that provides a lot of input to our children. Second thing you can do is we call it a bit of a lazy parent. The lazy parent approach is you do things halfway all the time. Then, for example, if the child want to play bubble, you don't open the bubble bottle straight away. You just pass it to him. You'll be like, hey, today my parent forget to turn it on. Twist it open for me. Then the child will pass it back to you. That's a step of communication. Then we can teach, open. Okay, then the child, okay, I'll take it. There's a way or use a voice to tell me something. I'll take it. So that's some little tips I can give at this point as an easy start, which is do things halfway, talk like a radio. And I think one more that a lot of us find it very hard is to wait. As a parent, I would say 5-second rule. When you say something, don't keep repeating. It's just because your child cannot answer, you repeat also the same. So what I can suggest is you wait 5 seconds, see if the child has fully processed what you say. Let's say you say, okay, give me your cup. No response, right? Give me your cup, give me your cup, give me your cup, give me your cup, give me your cup. Doesn't help. There's no space for the processing to happen. But what I would suggest is we just say, give me your cup, and then wait. The child will be like, oh, it's expecting me to do something. Let's do something with the thing in my hand. Maybe they'll be correct. Then there we go. Then that is a way that we can encourage communication. Yeah.
Emma, I really appreciate that 3 tips. I wrote it down. One is actually talk like radio. I think that is a way for us to remember. Second is actually lazy parents' way is that we don't do everything for them, create some opportunity for them to request and to communicate with us. And the third one is actually we don't be too rushy. We have to be a bit more patient, wait, for the moment for them to process and either process to react to it or process to express their needs and things like that. Wow,
Yep.
good. Thank you.
Very
Thank
good
you.
summary.
Thanks for the okay. Yeah. And one more question from me is actually, could you share a success story where speech therapists make a big difference in a child's life that, as a speech therapist?
Right. Being on this journey, I've seen clients of all kinds, but I think some that really stick with me is those earlier, my first few clients, because that's when I journeyed the longest with them, right? So I think I'll just share with this boy. Let's give it a name, Peter, okay? Let's, for his privacy's sake. So what really struck me was how much he has achieved right now and where he started. So this child come in when he was about 2.5, 3 years old. No words, no eye contact, nothing. What he does is he take 100 ringgit note and shake it. And then that sound of notes, it's beautiful in his ears. And then he'll shake it, and then he'll flap his hands because it's amazing feeling on the fingers and the ears. So that's where we started. So we use that interest as a starting point. So we're just doing wave and stop, learning to listen to instructions and then to give us instructions on what he wants me to do, which is give him a note. So I have $100 in the session, and then we'll hide it somewhere in the room, and then he'll come and find $100 note. There, then pointing. Then he started pointing at it, and then then we kick down. Then eventually, there comes two-way communication. And fast forward another year, we start to use a lot of words already. We have a lot of short 2-3 word sentences coming about in exchange, which is great. It doesn't just I talk, but he talk, I talk, he talk, I talk. And then fast forward a bit more, 5 years old, he went to a mainstream kindergarten. Even though being neurodiverse, he's on the spectrum. He has enough words and ability to socialize and following the teacher's instruction, and I guess not too scary for him to be in a kindergarten anymore. That he went to a mainstream kindergarten and he made meaningful friendships from there. And then fast forward a bit more, he's 8-9 years old, I think 9. And then what he's doing is he's doing really well in school and he has friends, and then he's enjoying drawing art as his hobby. And it's just really nice to see how the early intervention has allowed this child to have this section of life where he can enjoy and find his own interest and meaning in life. And I see that as a success story, even though being on the spectrum, he still have a lot of difficulty in social skills, finding it hard to not be abrupt in people's face and don't straight away, he's the kind of honest child where wow, your hair really ugly today, you know? He's like, whoa, whoa, whoa. You don't say that, but yeah, but that's him. You know, we just take it as he is and try to say, hey, excuse me, we gotta be kind with our words, and this is how, you know, where he is right now, not perfect, and he's still on a journey, but it's the vastness of concept and ideas that he has in his head allows him to be having the chance to be taught how to socialize. I can say that's not kind, then he understand what does kind means. Then he can then alter his sentences. Okay? So having a strong language ability from the start really help even to individuals on the spectrum to later learn about all these social rules in a very textbook way. Yeah, I find that it's such a gift that we can give to these children at the start. That's why early intervention, very important. Yes, it makes a huge difference.
Yeah. Kevin, your turn to summarize. Thanks, Emma. Thanks, Emma. Yeah.
Okay. Thank you, Emma, for sharing that very inspiring story. I guess for any parents, especially in the first few time that they have to bring their children to see a speech therapist, knowing that what is possible down the journey, it's very important to keep the hope alive and also to keep the act of continuing to bring the children to see the speech therapist something in their routine. And today I learned a lot from you, and I'm sure listeners also found a lot of new information that are very important, especially in recognizing that, you know, the developmental milestones and what to look out for, and why sometimes hoping that my child is just a late talker may not be the best way for us to count on this hope. And there are other areas for us to assess and seek for help. And you also share with us on how AAC can be very instrumental in supporting the development of language and speeches. I mean, as a parent, I can relate to this, that when the recommendation for us to get AAC for my son was made, I had this mind that, does it mean that he cannot speak? So I am glad that that thought did not prevent me from just going ahead, because I rely on the expertise from the therapist to advise us on what to do next. And sometimes we have to trust the team that is working very hard to support our children. And while we have our fear, it's also very important to take in the advice wholeheartedly, but not only filter to what we like to hear and then do the thing that we feel good to do and forget about the unpleasant one. Sometimes all this growth only happens when we do the hard choice and the hard things that we need to do. And compared to sharing this episode with people that you know, to the listeners, it's a lot easy to do this, and it has a lot of meaning. And today we learned a lot from Emma, and I hope we can have Emma back with us for the next future episode. But for now, we are quite grateful and count our blessing that you are sharing all this with us. And the checklist or the milestone that you mentioned, Emma, I will also get it from you, and then we can put it on the show note for people as well. So with
Sure.
that said, that's the last word from me. If you have any question, please do remember to send us the messages or email us. And I also put a link to connect with Emma, if that's okay for you, Emma.
Yeah, sure.
All right. So any last word from the co-host?
No.
No. Okay. All right. So we see you again in another episode on episode 15, but this is episode number 14 of Adapting Together. And we are signing off here. Bye bye.
Thank you.
Thank you.